Supervisor Catherine Barger, Chair of the Los Angeles County Board of Supervisors. Dr. Barbara Ferrer, the Los Angeles Director of Public Health, will provide an update on the latest COVID-19 trends and efforts to stem the recent increase in case counts and the rate of positivity. Dr. Christina Galley, Director of Department of Health Services, is also going to provide information on current utilization of the county hospital system. Unfortunately, the 7-day COVID-19 case averages have nearly doubled since the beginning of November, and hospitalizations have increased from an average of about 900 a day to more than 1,000 a day during the same period. The Department of Public Health has attributed much of the recent rise in case numbers to an increase in gatherings. As many of you heard yesterday, the county announced additional precautions that will take effect on Friday to help protect public health and ensure the safety and well-being of our residents. I understand that there's been some confusion over the last couple of days, but I'd like to clarify that this is not a curfew or lockdown, but a precautionary measure while requiring non-essential businesses such as restaurants, breweries, wineries, and retail operations to close between the hours of 10 p.m. and 6 a.m. We are also asking that personal care services be conducted by appointment only and limit their capacity of operations. I want to emphasize that approximately 95% of businesses that have reopened have been in compliance with public health guidelines. However, we are implementing these precautions to help prevent the ongoing community transmissions. We hope these actions get the attention of individuals who are not using caution in social settings and encourage them to be vigilant. These precautions are safety measures and not unique to Los Angeles County. Cases are rising throughout California and across the nation. I want to highlight that while our numbers are rising, California does have the 8th lowest positivity rate nationwide, and there is hope on the horizon with promising vaccines and therapeutic treatments. We are at a crucial juncture, and we need to call on all of our residents, businesses, and organizations to do what science tells us is right. Please continue to wear a mask, observe 6 feet of space, and don't congregate with people that you don't live with. These are important things to remember. Our residents and our communities have been patient throughout this process, but we need to continue to do the right thing now more than ever. It will help us save lives, preserve hospital capacity for everyone who needs it, and get us through some of our most challenging weeks yet to come. With everyone pulling together, we can avoid the surging case counts and rising hospitalizations that will necessitate any more stringent measures in the future. I truly do thank you for your partnership during this process. I know it is difficult, but I'm confident that we can do it together. With that, I would like to invite Dr. Barbara Ferrer up to give the daily count. Thank you.
Good afternoon, everyone, and thank you so much for joining us. Thank you, Supervisor Barger, and to the entire Board of Supervisors. As Supervisor Barger mentioned, yesterday the county took action to address the surge in COVID-19 cases that the county is currently experiencing. I want to thank the board for continuing to make health and safety a priority and for their tireless leadership throughout this pandemic. In light of the steep increases in cases and hospitalizations, we are updating our health officer order to reflect the implementation on Friday of more restrictive measures in an effort to reduce transmission of COVID-19. We are focused in 2 areas: reducing the possibility for crowding and reducing the potential for exposures in settings where people are not always wearing their face coverings. I'll take the first slide, please. On Friday, the following safeguards and restrictions will go into effect. For non-essential businesses permitted to operate indoors, including retail stores, offices, and personal care services, occupancy will be limited to 25% of the maximum occupancy allowed. The number of patrons at outdoor restaurants, breweries, and wineries will be limited to 50% of the maximum outdoor capacity. The number of customers at card rooms, outdoor mini golf, go-karts, and batting cages will also be limited to 50% of maximum outdoor capacity. Services at personal care establishments may only be provided by appointment to customers wearing face coverings by staff wearing face coverings. Services that require either the customer or the staff to remove their face coverings, such as facials and shaves, are no longer permitted. Food and drinks cannot be served at these establishments to customers. Restaurants, breweries, wineries, bars, and all other non-essential retail establishments must close from 10 p.m. to 6 a.m. And as Supervisor Barger mentioned, this is not a curfew, and all of these sites will be able to continue with pickup, takeout, and delivery services after 10 p.m. Outdoor gatherings may only include 15 people who are members of no more than 3 households. In addition, the county has established, and I'll take the next slide, has established thresholds for additional actions if cases and/or hospitalizations continue to increase. If the 5-day average of cases is 4,000 or more, or hospitalizations are more than 1,750 per day, outdoor and indoor services at restaurants, breweries, wineries, and bars will be prohibited, and these businesses will only be able to offer pickup and delivery. If the 5-day average of cases is 4,500 or more, or hospitalizations are more than 2,000 per day, a safer at home order will be mandated for 3 weeks. The order would only allow essential and emergency workers and those securing essential services to leave their homes. In addition, a 10 p.m. to 6 a.m. curfew would be mandated, with essential workers exempt. We're reminded that we face one of the most dangerous moments in this pandemic, and that the only effective path forward requires immediate action and, unfortunately, additional sacrifice. When the rate of increase is as high as it is right now, it can be harder to slow the spread. Heading into colder months and the flu season compounds the sense of urgency. Next slide. If we continue at the rate of increase in cases and hospitalizations that we're seeing during this current surge, by early December, daily cases could be more than 4,000 per day, and daily hospitalizations could be between 1,600 and 2,600. This is less than 3 weeks from now. We should each ask ourselves and those we care about to commit to making the changes we know will prevent a great deal of suffering and death from COVID-19. Change any plans for indoor gatherings that involve people not in your household. Avoid all activities where there will be crowds and where it's hard to maintain a distance of at least 6 feet from others. Wear face coverings inside and outside if you're with people who are older or who have underlying health conditions, and this includes people in your own household. And make sure to follow all the rules at businesses, work sites, and retail establishments. I know it's frustrating for all of us to feel like we're moving in the wrong direction. And I do not want us to look at the past months and all the work we've done to slow the spread and see failure. We have not failed. We have taken action in the past, and we've worked together, both early in the pandemic and in the summer, and we've been successful in preventing transmission in our communities. And we just have to get back to doing that work again. I'll take the next slide. COVID-19 is relentless, and we've seen other communities and states where there are few or no restrictions see devastating numbers of people becoming seriously ill and passing away. This slide shows in Utah the current crude case rate is currently over 1,200 people who are positive per 100,000 residents. In Indiana, the rate is 1,100 per 100,000 people. Here in California, in spite of the fact that, as you can see, we're surging, Our recent case average has been around 250 cases per 100,000 people. What we did in the past worked, but we need to renew our commitment and our diligence in slowing the spread of COVID-19. And the restrictions that are in place also work. And it's unfortunate that we're back to having additional restrictions. But we cannot be in the same place or space where other states have headed. We cannot jeopardize our healthcare system. I'll take the next slide. Now to update you on our current status. We're sad to report an additional 36 people have passed away. 16 of the people who died are over the age of 80, and 12 people who passed away in this age group had underlying health conditions. 9 people who died are between the ages of 65 and 79, and all of the people in this age group had underlying health conditions. 8 people who passed away are between the ages of 50 and 64, and 7 people in this age group had underlying health conditions. 2 people who died are between the ages of 30 and 49, and 1 person in this age group had underlying health conditions. Information on the 1 death reported by the City of Pasadena is available at cityofpasadena.net. Of the 35 newly reported deaths today, excluding the death in Pasadena, 5 were people who resided in our skilled nursing facilities. And this does, unfortunately, bring the total number of deaths to 7,335 across our county. Our deepest sympathies go out to everyone who is experiencing the sorrow of losing a loved one or a friend from COVID-19. We wish you comfort and healing during this most difficult time. For the 6,920 people who have passed away where race and ethnicity has been identified, 52% are Latinx, 23% are white, 14% are Asian, 10% are Black, slightly less than 1% are Native Hawaiian or Pacific Islander, and 1% identified with another race or ethnicity. We are reporting today 3,944 new cases, and this brings the total number of cases in LA County to 348,336. These cases include 14,487 cases reported by our partners in the City of Long Beach and 3,160 cases reported by the City of Pasadena, both which have independent public health departments. We're reporting a total of 2,232 confirmed cases among people experiencing homelessness. 1,188 people are currently hospitalized with COVID-19, and 27% of the people who are hospitalized are in the ICU, and 15% are on ventilators. This represents 9 days of a continued increase in the numbers of people hospitalized. We've investigated a total of 2,421 residential congregate settings and non-residential settings with at least 1 confirmed case of COVID-19. Currently, we've also seen an increase in our outbreak investigations, and we now have 482 ongoing investigations. We have closed 1,939 investigations. We're sad to report that 3,094 residents in institutional settings have passed away from COVID-19, and that 2,736 of the people who died in institutional settings resided in our skilled nursing facilities. We are reporting 4,024 confirmed cases at some point in jail facilities. 3,508 are among people who are incarcerated, and 516 are among staff. There are 270 cases in the state prison, 195 among people who are incarcerated, and 75 among staff. And there are 760 cases in the federal prison facilities, 743 among people who are incarcerated, and 17 among staff. There's 187 cases in the juvenile facilities, 87 among youth, and 100 among staff. To date, over 3.4 million people have been tested and had test results reported in LA County, and the cumulative positivity rate is almost 10%. The next slide. As always on Wednesday, we review this county's recovery measures. This slide shows the seven-day average daily number of COVID-19 cases by episode date. As a reminder, episode date is the date a person took a test or first experienced COVID-19 symptoms. And you can see on this graph the current surge in cases is highly evident and has been particularly pronounced since November 1st. On that day, the average daily cases were a little over 1,100. 1 week later, on November 8th, the average daily cases was almost 2,000, and today we're almost at 4,000 cases. I cannot stress enough how concerning this is. Next slide. This slide also shows our test positivity rate, or the percentage of tests that are done that come back positive. Like cases, our positivity rate is also increasing. On November 8th, the positivity rate for LA County was 5.1% compared to 3.9% on November 1st. Today, our test positivity rate is 7.1%. The increasing test positivity rates are more evidence of increased community transmission. Next slide. The daily number of hospitalizations of people with COVID-19 is one of our most reliable metrics in understanding how we're doing at reducing the impact of illness severity with transmission of the virus. It paints a picture of how many people have become seriously ill, and as cases have increased over recent weeks, unfortunately, we're now seeing hospitalizations also steadily increase. On November 1st, the average number of people hospitalized for COVID-19 was 791. 2 weeks later, on the 14th, that number had increased to 1,010. And as I noted today, we're now approaching 1,100. We continue, on the next slide, please. We continue to see a decrease in daily deaths from COVID-19. On November 8th, the average number of deaths per day was 10. That's the lowest number we've seen since the very early days of the pandemic in March. The continued decrease in deaths is likely in part because of improvements in treatment for people who are seriously ill from COVID-19. At the same time, we should expect that with the rapid increases in cases and hospitalizations, it is also likely that we will tragically see increases in people passing away from COVID-19. Next slide. And as we do every 2 weeks, I'm going to drill down into the data we have that shows how different groups of residents are faring in terms of cases, hospitalizations, and deaths. Our goal as we navigate through this pandemic is to make sure that we all get through it together as safely as possible. This means that we need to continue to understand the impact of race, ethnicity, and income on outcomes. This slide shows the daily adjusted rate of cases per 100,000 people broken down by race and ethnicity since April. The top line in yellow is the case rate for Latino, Latinx residents, which continues to be higher than the case rate for all other groups. After the July surge through mid-September, we saw the gap between Latinx residents and all other residents begin to close. At its lowest point, Latinx residents had case rates that were less than 2 times that of white residents. However, as you can see on the graph, since mid-September, once again, the gap is growing, and in recent weeks, Latinx residents are experiencing case rates that are now almost more than 2 times that of white and black residents. Asian residents, and that's the blue line at the bottom, continue to have the lowest case rates. Next slide. As with cases, Latinx residents, shown here again in yellow, also experience higher rates of hospitalizations than all other racial and ethnic groups. Black residents in green have also experienced consistently higher rates of hospitalization compared to white residents. That's shown by the orange line. White residents are the orange line. We can see that hospitalizations among Latinx reached a peak of 30 hospitalizations per 100,000 people back on July 11th, and that rate was 3 times that of white residents. But the gap slowly closed from July through mid-September, when hospitalizations for Latinx fell to about 8 hospitalizations per 100,000 people, and that dropped to only 2 times the rate of hospitalizations for white residents. Unfortunately, again, the chart shows that the gap is growing once more. In the same way that hospitalization rates amongst Black residents hit a peak of 15.7 hospitalizations per 100,000 people back in July, and that rate was over 2 times the rate of white residents, the gap was closed significantly, and Black residents on November 7th had a rate of hospitalization that was only slightly higher than that for white residents. But once again, all of the rates are going up. Asian rates, shown in blue, have experienced hospitalizations that are similar to white residents, and since mid-August have had rates that are lower than all other racial and ethnic groups. Next slide, please. Deaths by race and ethnicity shows a similar trend. Latinx residents, again in yellow, have higher rates of death compared to residents of other races or ethnicities. And while once again we were making progress in reducing the gap amongst people of color when compared to white and Asian residents, we will face similar fear of a widening gap should we see our death rates continue to go up. Next slide. In addition to race and ethnicity, we also track differences by income to understand the impact of low socioeconomic status on disease transmission and outcomes. Here you can see again the direct relationship between high rates of poverty and high case rates. Those who live in areas of the county with the highest rates of cases are also the same people who live in communities with the highest poverty rates, and that's the orange and the yellow lines on the graph. Next slide. Deaths by area of poverty. Again, the impact of area poverty on death rates is apparent. Those residents who live in areas with the lowest resources and highest rates of poverty, shown in the orange line, have experienced consistently higher rates of death compared to their most affluent neighbors. And while we continue to see a downward trend of deaths across all income categories, and that also showed up as a closing slightly of the gap between the highest income areas and the lowest income areas, the death rate in the lowest income areas was still more than 2 times that of those people who live in the highest income areas back on November 8th. Ensuring that we eliminate inequities in health outcomes remains a priority for all of our work. As we witness the surge in cases, efforts need to focus on continuing those actions that safeguard the hardest hit by the virus, protecting low-wage and essential workers, ensuring easy access to testing and health care, creating safety net programs to support those needing to quarantine or isolate, and partnering with our trusted community organizations. Next slide, please. In closing, I do want to extend my warmest wishes for a happy Thanksgiving to everyone across the county. The year has been extraordinarily difficult for almost everyone, and we're not celebrating the holidays the way we want to. Traveling, seeing friends and family, having parties, and doing so many of the activities we look forward to, because these activities are just not safe. I want to share with you a few tips for having a safer Thanksgiving. First, we strongly recommend that no one travel at this time. If you do choose to travel, please follow the state's guidelines on travel, including quarantining for 14 days after you return home. It's best to stay home and celebrate with people who live in your household. Connect with friends and families you don't live with by using all of the technology that allows us to see and hear from each other from afar. If you do choose to gather, closely follow the guidance for private gatherings. Gather outdoors with no more than 2 other households and a total of 15 people. Wear face coverings unless you're eating or drinking, and stay at least 6 feet apart from those not in your household. Do not share food or utensils, and limit the gathering as much as possible to less than 2 hours. Finally, if you have the means to give to others, donate to your local food pantry or food drive to help ensure that those facing financial hardships have enough to eat this holiday season. You can find ways to help at covid19.lacounty.gov food. It's been a strange and difficult year, but I want to share that I'm thankful for all of you across our community. I'm thankful to live among neighbors who are kind and care for each other. I'm thankful to work with a team of people who have dedicated their lives and their careers to helping each other. And I'm thankful that my family and friends have found ways to stay together and stay connected even from afar. Thank you, LA County, for continuing to work together, for sacrificing for others, and doing what it takes to get through this very difficult time. Please know that I and our entire team at the Public Health are grateful for all you do and all you are. With that, I'm going to turn it over to Dr. Christina Galley to provide updates.